So let's talk about the mid-face. What is it about the mid-face that makes us look old and tired? Dr. Ennis Plastic Surgery, Boca Raton, Florida. So there's all the rage about the fat grafting to the face and cheek implants, but the reality is most of the volume you need is already there in the face. It's just aged and changed. So as we get older, what happens, the fat pads underneath our eyes get tired, they get heavy, the muscle gets tired and begins to fall forward, and you get the bags of your eyes. But unfortunately, the second part of the problem is this cheek pad right here descends. As it descends, it leaves you with some hollowness under here, or it makes this line look deeper. So then people start putting filler in that. Problem with filler in the eyelids, especially in the lower lids themselves, is that filler is designed to last as long as it can. So the way the company's designed is that as they begin to break down, they begin to absorb water and suck water into that area. Well, that's great if it's in your lips, terrible if it's in your eyes. 6 months down the road, a year down the road, people come back and say, I've got this terrible bag in my eyes. What happened? Well, that filler's down there and is still sucking water into that area, trying to support and keep its volume up. I get gray the lips, terrible on the eyes, makes it like you have bad hangover or bad allergies. So fillers and lower lids have to be very, very carefully done. I'm personally not a big fan of them. So what about fat? Can you do fat grafting in the face? Yes, you can, but most people don't need it. All the volume's right there. It just needs to be lifted back up. One of the big problems with fat that people don't think about is these surgeons are taking tummy fat in premenopausal women, 30, 40 years old, to take a tummy fat, putting it into the face. Well, we all know what happens. Unfortunately, when women hit menopause, they tend to gain a little bit of weight and they tend to gain weight in their midsection. Well, this fat that's in their face still genetically is tummy fat, and it still thinks it's tummy fat. So as their hormones change, they hit 50, 55, they gain a little bit of weight. All of a sudden, their cheeks begin to get really big because this fat was put in there 10, 15, 20 years ago. Genetically is still tummy fat, and it's changing with hormones just like it's supposed to in the tummy. So then they come in with these great big cheeks and say, what happened? My cheeks got fat. Well, and the first thing I asked them, did you have fat grafting? Yeah, 30 years ago, 20 years ago. Well, that fat's still in there, and it still thinks it's tummy fat. So be careful with fat grafting a face. Done right, temples and other areas, it works okay, but be very cautious about getting fat put in your face for premenopausal women, especially in the cheeks. So what's left? Well, let's just put your own fat back. So when we have a lower blepharoplasty or a mid-facelift, what we're doing is in a lower blepharoplasty, taking fat out, but then we lift the cheek pad back up. When you lift the cheek pad back up, it fills this groove and it makes this line better. If you don't have the puffiness under your eyes and you just need the cheek pad lifted up, that can be done endoscopically. Start an endoscopic mid-facelift. Small inches of the hairline, reach in here and pull this cheek pad out this way. So either way, most everybody, the volume needs already there. There are exceptions, but we like to take the volume and just put it back where it used to. And that's how we get a really nice natural look without looking overdone or plastic.